Common question I get is, and today what I really want to talk about is how many hours of home care do I really need? And very important question. And so I want to talk about a few factors today to share with you that you should consider in terms of how many hours of home care do you need, caregivers in the home. The first and foremost is what is very commonly called in medical terms activities of daily living and instrumental activities of daily living. So you might hear the words, whether you're talking with a nurse or a social worker, about ADLs and IADLs. So basic daily tasks such as bathing, grooming, brushing your teeth, eating, walking, going to the restroom or toileting. Instrumental activities of daily living or really independent living is cooking, medication reminders, cleaning, running errands. And so you hear that a lot, IADLs and ADLs, and that's something to consider. That's probably the number one factor to consider in terms of how much home care do you need. So think about we have clients that struggle to even get out of bed. I mean, that's an ADL, an activities of daily living, where there's high acuity and they are bedridden or they can't get out of bed, as an example. Number two factor is thinking about yourself or your family, your loved one, their cognitive health in terms of memory issues, dementia, Alzheimer, if they have a tendency to forget their medications or they wander or they're highly combative. Number two, that's cognitive health, right? That's a really big one, as well as you can imagine being safe in the home and making sure that your loved one is safe in the home. Number three is more around your medical needs, or what you may hear is called skilled activities, like a nurse or wound care, or someone needs to administer some shots or insulin shots, things of that nature. Typically, at least in the state of California where I am in, some home care agencies have that license and a lot of them don't. Usually, if you are quote unquote can't leave your home, you are more or less homebound, you should look into getting qualified, and your social worker should help, or your case manager, if you have one assigned, should help you get a home health agency who's going to apply that skilled care. Or if you're discharging to be hospice, to be in your last moments in your home, they should be able to refer to a hospice agency, as an example. But all of them are able to do skilled care. Those types of agencies, they may come 1 or 2, 3 times a week, depending. And it's not a long amount of time, but some of them may include bathing is included 2 or 3 times a week. So again, you might not need home care or caregiver to do that on those days. So you could save some dollars out of your budget, as an example. So something else to consider. Another thing is just family support system, whether it's a neighbor, a kid, an uncle, someone who could come in and take care of you or check in on you, or even just nights. That can also reduce the amount of hours you need. Another factor is fall risk or safety concern. If you have a really high fall risk or have a tendency to fall, or your loved one has a tendency to fall, has a history of it, then you're going to need more hours of care. Because at the end of the day, as we all know the statistics, once a loved one, especially an elderly person, falls, it doesn't look good in terms of statistics, right? So you want to prevent that fall. The last factor is around schedule preferences. Everyone has preferences. All my clients, my census, some people like people in the morning, which usually they're most active, right? In the morning or the afternoon, and then winding down. Some people like someone to help them to get into bed and get them ready, as an example. So also to consider that as well. I think you need to talk with your loved one around what's best for them, right? Let's say they like to do Tuesday, Thursday, they like on bingo at the local senior center, as an example, or on Wednesdays, they always like to do X, or on Sundays, they like to go to church in the morning. That's very important. So that's just something to consider. And then a couple of other things to consider in terms of how many hours of home care do you need is, of course, looking at your budget. If you have long-term care insurance or Medi-Cal in the state or Medicaid, consider what can be covered around that. If your home environment is safe, does it require modification? Do you need a ramp? Do you need grab bars? Things of that nature, that's something to consider as well in terms of the fall risk, and if you need someone around to help you. So those are just a few things top of my head. And really to wrap it up, I'll give you some scenarios to consider. And at the end of the day, based on these factors, a lot of it depends on acuity again. So we we have clients that only need one shift a week, 4 hours a week. And that's really what we call respite or break care for the spouse, where the spouse is taking care of the loved one and they essentially just need a break for 4 hours a week. So we handle that. And then we have clients that are 24/7, and that's really high acuity, or they're bedridden, or they're on hospice. And so they really can't do much for themselves. They even need help feeding. And so we do that as well, to give you an example. But most people are somewhere in between. I think also, I will say from my experience, it's common for sometimes for social workers or for patients to just assume, oh my gosh, I'm going to need 12 hours a day or 8 hours a day when my adult child is out at work. And so that I find it's common, but I would say not as common as you think. I think most people, what we want is, we talk about the efficiency of the caregivers, how do we work within all these factors or schedules, of course, keeping you safe in the home, preventing a hospital readmission as an example. But at the end of the day, it's not something where it's 24/7 or 12 hours a day automatically, which I think is a misconception or a false assumption by a lot of people. And so I want you to think about those factors I talked about. Again, things that you take for granted in living: your cognitive health, your medical needs, your family or support system that you have locally, your fall risk or safety concerns, and then any schedule preferences that you may have. And then lastly, most home care agencies offer an in-home complimentary assessment or consultation. I highly encourage people to do that, because there's really just, it doesn't sign you up for anything, and it's complimentary, and you're going to get a skilled professional coming into your home and really trying to talk you through these factors and understand and make that observation, which a lot of times a third party helps with that. So you can get an idea around what's the care plan I'm looking at, what's the cost, and how many hours, and then work from there.